You're listening to a podcast from beautyanddc.com, the website that brings you the best discounts and information on beauty services in the Washington metro area. Here's Beauty and DC co-founder and your host, Marilyn Thompson.
Joining us on the podcast today is Dr. Mark Richards. Dr. Richards is a practicing plastic surgeon in North Bethesda and also an anti-aging specialist. Thanks a lot for joining us, Dr. Richards.
Thank you, Marilyn.
And so what we're going to talk about today, because I think this is such a relevant subject for so many women, is bioidentical hormones and how using them can really improve a lot of issues and symptoms we have as we get older, perhaps postmenopausal and things like that. First of all, what I'd like to ask you about is if you can kind of tell us what a bioidentical hormone is. Traditionally, as women age or have issues perhaps with their ovaries or any type of thing that may lead to symptoms, postmenopausal symptoms or other types of symptoms, doctors will prescribe hormones to them. I believe that bioidentical hormones are usually not what those doctors are prescribing. Is that correct?
That's correct, Marilyn. There's a lot of confusion, unfortunately, confusion that extends into the physician realm as well, and again, much more confusion probably in the public realm. A bioidentical hormone is a hormone that is molecularly identical. It's the exact same hormone that your body, a human body, would make. That's all bioidentical hormone means. It's gotten a bad rap because there has been a big fight. I won't even say a controversy, a big fight between pharmaceutical companies and researchers and proponents of bioidentical hormone therapy. The key problem is that a bioidentical hormone, a hormone that's made by the human body, is not patentable. And so there really is no money in its production. But of course, a bioidentical hormone is something that your body recognizes as normal and natural. And so the entire process from the hormone activating the things it's supposed to do to the hormone being degraded by the normal body processes and excreted is all much more natural or therapeutic than a non-bioidentical hormone or a non-molecularly identical hormone.
From what I understand, most of the hormones that are prescribed by maybe a traditional doctor would be like Premarin, I believe it's called.
Premarin? Yes, Premarin. Premarin is a classic example of an estrogen-type hormone prescribed for menopausal issues. Premarin, just to set the record straight, the name Premarin is an abbreviation of pregnant mare urine. That's how the name Premarin came about. It's a horse-derived hormone.
I assume that's not bioidentical.
That's exactly correct. That is not bioidentical. It would be a bioidentical hormone for a horse, however. The problem is the hormone is molecularly different than the estrogens that humans make. And therefore, the receptor activation of the human estrogen receptors from Premarin is different than what it would be for natural human estrogen. And the breakdown products of Premarin are different than what human-produced estrogen would be.
Okay. So if someone comes to you, and we're going to concentrate more on females today. I know that males can also benefit from bioidentical hormone therapy, but we're just going to concentrate on females for the purposes of this podcast. So let's say a woman comes to you and says, I'm having terrible symptoms these days. I'm having hot flashes. I don't sleep well. I can't concentrate. Maybe having libido problems. My skin is really dry. Many things that I guess would be associated with menopause, but perhaps you can tell us that, there may be other conditions that would also bring on certain symptoms that would be helped by bioidentical hormones. So what would be the process that you would go through with someone like that to try and, alleviate these symptoms and actually have them have a much better quality of life?
Well, this is a classic presentation. Most people don't have all of those symptoms, but many people have some of those symptoms. The first part of the process is patient education, because as I stated in the beginning, there's a lot of misinformation both in the medical field and in the public sector about what we need as far as hormones and even what constitutes menopause. it's a shock for my patients to find out that you can be in your late 30s, you could be ovulating, fertile, having normal periods, and still be developing menopausal symptoms. And in fact, I have patients in my practice that fit that category exactly. It seems from all the research, and this has been going on for over 70 years now, that menopause in women is very similar to andropause in men, which we'll talk about maybe on a later podcast. But it's both cases is due to decrease in the testosterone levels. A woman at 40 has less than half the testosterone of a woman at 21. Now, you probably have a lot of listeners thinking, well, what is this guy talking about? Testosterone is a male hormone. It's not a female hormone.
I know. I was thinking to myself, don't you mean estrogen? I thought that was the thing we're worried about.
No, actually, it is not really the thing that we're worried about. Starting back in 2000, researchers in Australia, Yvonne Simpson and his group, discovered that almost all the tissue estrogen, that's the estrogen inside the cells in your tissue where it's actually working, in both males and females, is made from testosterone. And if you think about it evolutionarily, it doesn't make sense that men and women would be all that different, and in fact they're not. They're physiologically identical. The only thing different are the reproductive organs. So our tissues are very similar. As a matter of fact, our tissues are basically identical and require the same hormones for proper function. In other words, a man's bones and a female's bones both require high levels of estrogen in the bone cells to keep the bone density normal. But as we know, men don't produce much estrogen that circulates around in the bloodstream. And if we think about it, women really don't produce very much estrogen that circulates in their bloodstream except for 25% of their lifetime. And certainly women are healthy during the other 75% of their lifetime. And if we look at it even further, women during 1 week of their 4-week menstrual cycle, when they are fertile and do have high levels of estrogen, 1 out of those 4 weeks, their level of estrogen may be even lower than their husband's, because that's the way the cycle works. So to say that women need a high level of circulating estrogen to be healthy just makes no sense. Really, we're low on testosterone, and that's what causes those menopausal symptoms. Now, you could counter and say, well, but the testosterone is being turned into estrogen inside the tissues, and that is correct. But our human bodies are designed to use the testosterone in that manner. They're not designed to use high levels of circulating estrogen to support the estrogen needs of the tissue. Does that make sense?
It does, and but as you said, I think a lot of people will be surprised to hear that, because I think we've traditionally thought in different ways, maybe from things we've been told by the media or what we read or been told by doctors, that, we may have been told different things.
I think we're told different things, and don't think it's a conspiracy, and I don't think that people are out to fool you. I just think there is a lack of education. There certainly was a lack of education in medical school, and there still is. There's a lack of education in doctors' continuing medical education. Some of it has to do with the fact that testosterone is a non-patentable drug, and so there's no money to be made in it, and the funding for medical education is mostly from the pharmaceutical industry.
Now that part does make sense. I think most of us can sort of understand, that it maybe comes down to dollars and cents to some extent.
It comes down to dollars and cents a lot, and it doesn't mean that all the pharmaceutical companies are conspiring to keep us in the dark and keep us sick, as some people that are really out there on a limb are saying. However, they are conspiring for each one of them to make as much money as possible on their products, because that's their obligation to their shareholders. Unfortunately, what that means is that if there's a competing technology that's better, they'll do whatever they can to make sure that technology doesn't get out there, and that they can continue to make billions off of what they're selling.
Right. Well, I'm glad we have you to sort of clear up some of that for us, and to get, more into what someone who is experiencing, as we talked about, some of these symptoms can do, and your particular way of alleviating these symptoms, because you do have a particular system that you use. And so I want to really go over that. First of all, when someone comes into your office, maybe you could just kind of walk us through a typical appointment with someone when they come in with the symptoms that we discussed.
Sure. When they first call up to book a consultation about this, I fax them or email them a lab sheet so that they can have some baseline hormone labs drawn. Not so much that I can dose them, but I sort of get a baseline as to where they are. Then when they come into the office, the initial session probably lasts about a half an hour to 45 minutes, and it's a lot of patient education. Some of it we already went over in the previous few minutes of this podcast. At that point, they fill out a symptom sheet. There's internationally validated menopausal rating scales, and people just go through and place checks on where their symptoms are. By looking at that, I can have a very accurate guess as to whether they're going to benefit or not from hormone therapy. Now, I just got through saying that we really don't need estrogen. Men don't need circulating estrogen. Women don't need circulating estrogen. Really, we need testosterone so that the tissues can make as much estrogen as they need. So at that point, we evaluate their needs for relief of these menopausal symptoms. We discuss the fact that not only are there symptoms of menopause, but the symptoms are compounded by the fact there's underlying health issues. For example, heart disease goes up at a much higher rate in people with low testosterone than people with higher testosterone. The risk of diabetes is 3 times greater in people with low testosterone. The risk of metabolic syndrome is much higher. People who are obese have much lower testosterone. Depression is 3 times more common in people with low testosterone. In fact, a German primary health care study done in 2011 showed that the mortality rate of women in the lower third of testosterone levels was about 45% higher over the next 6 years compared to women in the top 2/3.
Well, this is interesting because it's not just about, getting rid of hot flashes, or it's not just about maybe having more energy or feeling a little better. I mean, you're really actually addressing some health issues here too.
Some very important health issues, including cognition. There's been evidence to suggest it helps protect you against Alzheimer's even. It's not just quality of life, which is ultimately very important, but it's also about life itself.
I would assume that once you are able to sort of get a picture as to where this person is, and on a scale of, you try and decide what they need in terms of dosage of testosterone?
Exactly. We talk about dosing somewhat. We talk about their preconceived fears, which usually include, am I going to become a man? The answer to that is absolutely not.
I was going to ask
you
you about
cannot
this.
become a man.
Or lower voice, hair growth, things like that.
You're not going to get a beard unless I give you massive amounts of it. There's no way, no matter how much I give you, that you could ever grow a penis. So it's just, none of those things can happen. The worst that could possibly happen is if I give you a little too much when we're trying to dose you, you might have to pluck a few extra dark hairs or wax, a little sooner than you normally wax, something like that. That's about the worst you can expect. So we select a dosage, and I tell my patient quite candidly, look, I'm pretty good at guessing, but every individual is unique. Everybody needs a specific amount to get rid of their symptoms and be healthier and feel healthier and be happier. But I don't know exactly what that ideal dose is for you yet, because this is the first time I've seen you. So we make a guess, and we put in a highly compressed testosterone pellet. It's about the size of a grain of rice, and it lasts 3 months. So in the fat of the upper buttock, I'll wipe the air with alcohol and then make a small injection with some lidocaine, the topical injectable anesthetic, to numb up the skin. Then I go ahead and put a tiny nick in the skin that's, just a couple millimeters, which is less than the 16th of an inch, I guess, and use a metal straw with a plunger to put the rice-sized pellet deep into the fat. The skin doesn't even need a stitch. We just use a skin tape to close it. And the pellet can't even be felt because it's deep in the fat and it's quite small. It's very tiny. Right. It's very tiny. It's pure bioidentical or molecularly identical testosterone. It is derived from plant sources. It's there slowly dissolving at a fairly steady state for 3 months. So about every 3 months, that woman would come back and get a new grain of rice put in. After about a month, for a first-time patient, I see them back in the office and we go over what their symptoms are, how much improvement they've had, whether they feel that, they would want more next time or a little less next time. And then I see them again at every 3-month interval to put in another grain of rice.
Well, we're going to talk in just a moment about what kinds of improvements you see in people once they have this bioidentical hormone pellet. But what I do want to ask you real quickly, because I think I've been under the impression that, I know that there's a difference, obviously, between bioidentical hormones and non-bioidentical hormones, but I always thought the bioidentical hormones were sort of given in a cream or something. Is that one of the ways that people...
That's really an excellent point. And I should have talked about that a little earlier. There's different ways. A bioidentical hormone is one that's molecularly identical to what you make. So it doesn't matter if it's in a pellet, if it's in a cream, if it's in an injection, if it's in a pill, if it's in whatever. So let's just, for 30 seconds, go over the different formulations. First of all, if you had a bioidentical testosterone or bioidentical estrogen in a pill, it's not going to work. The minute you swallow it, it gets absorbed by your intestines, it goes through your liver breaks it down immediately, and it never hits your bloodstream. So that's a non-starter. Next thing you could do is you could do a cream. Now, these are patented, not because the hormone's patented, but because the substance in the cream that allows it to be absorbed through your skin is patented. And so there are some pharmaceutical companies that make this. The problem with the cream is how well is it getting absorbed? Is it the right amount? Is it the wrong amount? If it gets absorbed really quickly, then your levels spike up, and then they drop down for the rest of the day. If your skin's wet, if your skin's too dry, it doesn't get absorbed. It's very difficult to provide what your body naturally does when you're younger, which is a steady state availability of a certain level of the hormone. So I'm not a big fan of creams, and I have a lot of patients that have been on creams that then switch to the pellets, and they're much happier. Also, a lot of the patients on creams have also been doing estrogen creams, and estrogens tend to be stimulatory hormones. They tend to increase uterine lining, for example, stimulate breast cancer cells. Estrogens tend to make people retain body fat, retain water, those sort of things. And these are things that women just don't need unless they're trying to get pregnant. So I stick with the testosterone. Another method is injection. The problem with injection is, as you might imagine, you get a whopping dose right in the beginning, so you spike very high, and then your levels start dropping, and you start to feel poorly again several days before your next injections do. And this is really not very suitable, in my opinion, for women at all, because you don't want to get their testosterone too high, and certainly when it gets too low, they don't feel well.
The pellet, which delivers, I guess, a very more even type of dosing, is, I guess, optimal in how you would want to treat the symptoms, because I guess you don't want to, one day you feel great, then the next day you're down again, or whatever.
Exactly, and additionally, if you think back to what I said in the beginning, is that the cells convert testosterone into estrogen. They do it through an enzyme called aromatase, which probably some of the people listening to the podcast have heard about. And each cell that needs estrogen, your bone cells may need much more than your brain cell, but your vascular cells may need 2 times more than your bone cells. Each cell has certain levels of aromatase to create the right amount of estrogen that it needs for proper functioning. And if your testosterone levels keep shooting way up and way down, the poor cells have a very difficult time trying to figure out how much aromatase they need to have and how much conversion they need to do. It becomes an impossible task for them, and you can never really function optimally.
Well, then that's what I want to get on to next, is what type of reaction do you get after someone has been using the pellet? I'm sure it takes, I think maybe it takes a week or two for it to really kick in and for them to start feeling the effects. What kind of reaction do you get from people after they've been using them?
Everybody hopes that I can give them the pellet, and then it's like turning on the engine of the car. Everything works. The lights go on, the radio goes on, everything's working all at once. In fact, the human body doesn't quite work like that. When I put the pellet in, I explain to the patient, here's what you can expect. Number one, everybody's different. But I'll tell you what the majority of people experience. Usually within the first week, people sleep much better, their energy level's better, and their mood starts improving. But that's just the beginning, and that continues to improve for months. Libido increases, the skin starts getting less dry, the body fat starts to decrease, muscle tone improves, and that occurs after several months and keeps improving for up to a year or two. Things like vaginal dryness and stress incontinence, those things improve within usually 2 months. So there's a whole range of time periods for each of the symptoms to improve. And when they start improving, that doesn't mean that's your maximum improvement. That's just when you first notice it, and it continues. For example, blood sugars in somebody who's pre-diabetic, which is a common problem that people put on weight with menopause, start dropping at 6 weeks. Cholesterol levels start dropping by around 6 weeks. But they'll continue to improve, especially as you continue to lose weight, lose body fat, improve your muscle mass, have more energy, become more active, that sort of thing.
Is this something, having the bioidentical hormones and the pellets inserted in you, is this something you can continue to do for years and years? Is there, a cutoff time for this, or is this something you can just do for the rest of your life?
This is something that not only can you do for the rest of life, but I think the vast majority of people that start it should do it for the rest of their life. You can certainly stop it any time you want. And I have patients that are on it and love it, and they say, do I need to do this for the rest of my life? And my answer to them is no. You can stop any time you want, as long as you're willing to feel as lousy as you felt when you came to see me in the first place.
And how about as far as starting it? Let's say, is there an age where it's too late to start, or can you start it basically at any point in life?
In my opinion, I think you can start it at absolutely any point in life. I've had women, well into their 70s start it, and their only statement after, 6 months of being on this is, boy, I wish I had started this in my 40s. But really, there's no age limit. I have women in their 30s who are on this and are benefiting greatly from it.
And what would somebody at that age be doing it? Well, you said sometimes they could actually be going through menopause even then, I guess, or have some menopausal symptoms.
They do, and it comes down to the definition of menopause. If you want to define menopause as you're no longer having menstrual periods and you're not ovulating, okay, they're not in menopause. But if you're defining menopause as the menopausal symptoms of, hot flashes, temperature dysregulation, irritability, loss of libido, loss of energy, fatigue, fogginess of thinking, those sort of things, not sleeping well, then they're clearly in menopause. So it really depends on how you want to define the term menopause, which again is part of the problem. So for our purposes, I'm defining menopause as a relative androgen deficiency. In other words, a relative lack of testosterone in your system compared to what your body needs at that time. Because I know that by giving you testosterone, and it's been shown in scientific studies for decades, that if I give you testosterone, those symptoms will dramatically improve.
Everything you're talking about sounds wonderful. I mean, it sounds like a real, almost like a miracle for people who really are having a lot of issues and thought that, there weren't really any good cures for it. But I think we'd be remiss if we didn't at least just briefly cover, are there any risks? Is there any reason that, you've ever had to, remove the pellets? Is there any risk to this at all?
Okay, well, let's talk about the women and testosterone. Back in 1985, there was a double-blind study, meaning the doctors and the patients didn't know what they were getting, and they compared testosterone with estrogen, and estrogen alone as 3 different treatments for menopause. And their study finding was that testosterone alone was more effective than estrogen, and even more effective than testosterone plus estrogen in relieving all these menopausal symptoms. So they looked at side effects from it. Well, the side effects from the testosterone alone was that a small percentage of women noticed a slight increase in their facial hair. However, all those patients responded to a decrease in the dosage. And so that really is the side effect. If your dose is a little too high, you might have a slight increase in facial hair that we then just decrease the dose on your next treatment, and the facial hair problem resolves itself. Now, by giving you testosterone, we're not going to get rid of your facial hair, and we know that 80% of women over the age of 50 have to address facial hair somehow with plucking or waxing or shaving or whatever. So, it's not a miracle in that way, but as far as increasing your facial hair, it's a very small percentage of the patients, and that increase in facial hair goes away once we lower the dosage.
Okay. Well, that certainly doesn't sound like a terrible side effect, as you said, especially when you look at the benefits. When you make that comparison of the risks to the benefits, it's almost negligible.
Well, I couldn't agree with you more. I think the risk-benefit ratio is just astronomically small risk. The benefits are huge. I've had a number of patients that have osteopenia, thinning of the bone, which is common in women as they age, that I put on the testosterone pellet, and 12 months later their bone scans are either normal or greatly improved. And their primary care doctors are just astounded.
So, Dr. Richards, what is the cost of getting this bioidentical hormone therapy?
Well, that's a great question, Marilyn, because even though obviously you're saving lots of money from the health benefits of the hormone itself does cost you something. What my practice charges is $500 per insertion. So a woman can expect to come in every 3 months or 4 times a year. That's $500, so about $2,000 per year, which is about a Starbucks 5 days a week or something like that.
I think so, especially with the cost these days. And so does that include the testing and everything that's included? Everything that's also involved?
It includes the office visit. It includes the insertion of the pellets. It includes my time and the cost of the pellets. It doesn't include the lab work, but most everybody that I've been seeing has insurance, and their insurance certainly covers lab work.
Oh, okay.
We also have a form that we give to our patients so they can submit to their insurance for the hormone pellet insertions, because it is a hormone therapy and they are suffering from menopausal symptoms, and they usually have physical manifestations of some of those things. So patients can submit to their insurance companies, and there's hundreds of different insurance policies, and so we don't even get involved with that. We leave it up to the patient to talk with their insurance company, submit the form, and the insurance company determines what reimbursement they'll supply to the patient.
Oh, okay. So in some cases, you will get reimbursed from your insurance company even.
Yes, I think in some cases, probably in most cases, people are getting some reimbursement from their insurance company.
Okay,
but in order to keep the cost affordable for everybody, we just charge our flat rates and have people pay us at the time of service. In fact, the first time people come in, whether they're male or female, we have them pay for 2 insertions. Because of the timeline I spoke of earlier, we like to have people experience 2 insertions done at the right time period so that they can really experience the benefits of the pellet therapy. And then after that, it's up to them whether they want to continue it or not. And I can tell you there's probably about a 95% continuation rate.
That's a pretty good success rate.
Yep.
Well, thank you, Dr. Richards. This has just really been informative. There's, as you said, there's so much sort of misinformation out there, confusing information. I know I have always been a little unsure what bioidentical hormones were, what they did, whether they were really, whether they would be beneficial. So you have really cleared up a lot of that. And I think this is something that, a lot of people would look at because they've been searching for, trying to figure out how do I reduce the symptoms you're talking about, especially if they didn't have very good luck with some of the other, therapies we have discussed that maybe aren't effective.
Well, I put some of this information we talked about today on my plastic surgery website, and hopefully within the next month I will have a link to a website of mine that will be just on the bioidentical hormones for men and women with much more detailed information and information for physicians, information for how I can train physicians to do this procedure for their patients. So I encourage your listeners who are interested to either explore my website or come in for a consultation.
Okay, so how would somebody, you took the words out of my mouth, how would someone do that? Please tell us your website address and then also where you're located and the phone number for someone to call for a consultation.
Sure. I'm located across the street from White Flint Mall on Rockville Pike, so the building is a One Central Plaza building. My address is 11300 Rockville Pike, suite number 912, and the postal address is Rockville, Maryland. Technically, I guess we're located in North Bethesda. The phone number is 301-468-3458. And the website, which has all this information, is www.drrichards, that's drrichards.us.
Excellent. Well, thank you so much. Like I said, you've been really informative, and thanks for clearing a lot of the information up for us today.
Well, thank you for giving me a chance to explain my enthusiasm for bioidentical therapy.